afternoon, everybody. Thanks for joining us again for this month's Leadership Rounds edition. I am pleased to welcome former colleague and current colleague, and more importantly, my friend, David Dove, to the episode this month. David is a partner at Troutman Pepper Locke and leads the firm's regulatory and economic investment practice in the Southeast. Prior to this, David served in the highest levels of state government, including as executive counsel to Georgia Governor Brian Kemp, as interim director of the Georgia Environmental Protection Division, and as lead attorney in Georgia's tri-state water wars. And through that, he gained deep insights in the legal, political, and governmental mechanisms that impact the business community, including healthcare. Most relevant for us in our conversations today, David also has the privilege of serving as the chair of the Board of Regents for the University System of Georgia. As chairman, David and the other 19 members of the board provide oversight and governance for all of the state's public colleges and universities. And I think there are 25 now, David?
25.
25. David is one of the few individuals that is actually from Georgia as a Georgian, grew up in Athens, where he went to the University of Georgia for both his undergraduate and law degrees. He and his family, his lovely wife, Courtney, live in Marietta, and I have 3 lovely young children, one of which was born during COVID. So maybe we'll talk about that. That was a whole experience. But David, welcome. Thank you for joining us.
Yeah, no, it's great to be here. Thank you for having me on.
Absolutely. I should also mention David has racked up lots of accolades over his career. He's a former Leadership Georgia class of 2020, UGA 40 under 40, Thomson Reuters standout lawyer for 2026, top Georgia lawyers from James Magazine, and on and on and on. So he knows what he's doing in the legal world. But today we're really going to talk less attorney stuff and more leadership and maybe healthcare workforce. So, David, I kind of gave everybody the overview and the high level of who you are and kind of what your day job looks like. But I mean, maybe tell us really what those roles look like in day-to-day life, how you split your time between being an attorney and a really big job as chair of the Board of Regents, and importantly, like how you got into all this.
Sure. Yeah, no. And I was thinking when you were kind of going through my bio, I'm going to have to put a check in the mail to you. So, but I appreciate that. So I left the Kemp administration about 2.5 years ago. I've worked with and around Governor Kemp going back to 2009. And so I had got involved in politics at a kind of an early age when I was in college, and happened to meet the governor when he was still building houses in Athens through the Athens Area Home Builders Association. So he was in the state senate at the time. I was working for a home builder, and then later got into politics. And we reconnected, and so I had the good fortune of being with him both on the campaign in 2009 and 2010, raising money for him. Actually, even while I was in law school, worked in the Secretary of State's office, and I took a tour in private practice before going back to the governor's administration in 2019, where we met and became colleagues. And so I've been at Troutman now for about 2.5 years. We've got a great group of lawyers here. It's been a really kind of fun opportunity. What I tell people is I'm a venue expert when it comes to legal issues. And so I generally sue the government, which gets me a pretty positive view compared to other lawyers that you may talk to. But that's kind of the crux of my practice and working on government enforcement actions for our clients. And really, splitting with the Board of Regents, it's a second full-time job. We have to track our time here for everything we do. And so I know that I spent about 400 hours on it last year. I'll easily spend probably close to double that this year as chair. We have a full year of initiatives and things that we have going on. So, but it's an honor, as you said earlier. It's a privilege to get to serve in that role, and it's great to be able to develop those connections with our higher education institutions and work with the other members of the board who are just tremendous people.
Yeah, and it's a big board. It's like 19 trying to wrangle 25 different colleges. But I think one of the interesting things about your current work and the work that we're doing at GHA on behalf of our members on this call is really around the workforce, the healthcare workforce. I know that maybe talk a little bit. I know that in the past year or so, the board, not just USG system staff, but the board really chose to highlight and focus on healthcare workforce and established a whole sort of task force around that.
Yeah.
Can you talk a little bit about what that work looks like, what your priorities and goals really are?
Yeah, no, glad to. And so, yeah, we had a healthcare task force. One of my first initiatives as chair is we actually moved that into a committee role and put it on what we call our track committees. So at every board meeting, our healthcare committee is meeting as a part of our kind of track committee structure to address the issues that we see across the state, and we're trying to do that in a myriad of different ways. But what's unique about that is this is the only kind of industry specific committee that we have on the board. And it's because we have a lot of initiatives going on right now. We're expanding medical and dental education with the new UGA School of Medicine, who just admitted their first class of 64 students. We have the new dental school. The groundbreaking was just maybe last week or the week before in Savannah. We're still focused on strengthening GME. That's been a priority for over a decade now. But last year, we actually had 9 additional teaching hospitals participating in residency training, 35 new residency programs, nearly 900 new resident positions that have been created across the state. And that priority has also been reflected through the governor and the General Assembly. The FY26 budget, we had $17.8 million to expand GME. So that's been a huge priority for us. But in addition to that, we're also focused on expanding nursing. We have a new nursing school at the University of Georgia, and we're designing that school in a way to ensure that it avoids kind of cannibalizing our other nursing programs across the state. I mean, obviously the marquee brand of UGA, as I say, is a proud double dog. We recognize that could attract and recruit faculty and students from other institutions, and we're setting parameters around that school to ensure that we're really bringing new talent into the state. We're tapping into the UGA student population that is already wanting to go into nursing, and so limiting that where transfer students, can't be a part of that school. So it helps ensure that all the programs across the state are resilient because we do have very strong nursing programs, from corner to corner in Georgia.
And as I always tell everybody, like there is room for all of them, right? Like
Sure.
there is room for all of them and more, and the more capacity we can build, the better. Maybe slightly different question. As you're working with all these institutions, I think the legislature has certainly invested and the governor has certainly supported lots of capital resources into workforce and GME over the past few years. But I think there are other kind of constricting factors around the workforce and workforce education that aren't just limited to dollars. I think one of the things that I'm hear a lot and curious if you hear it as well is really around faculty recruitment and
Sure.
preceptors for those. Do y'all have those conversations? What are you hearing from campuses on their ability? I mean, their ability to admit more students into these programs and to partner with hospitals, and for hospitals to have students in these capacities and have preceptors is really kind of limited by that. Our ability to hire and keep good faculty on. Is that a topic y'all have talked about?
Yeah, no, absolutely. That's one of the kind of the key components to make sure that we continue to grow and maintain resiliency in the workforce. So, I mean, we've actually got some news that will hopefully be coming out later this year that will kind of highlight how we're enhancing the emphasis on recruitment and retention for faculty. One of the big pieces in that is we offer a great deal on higher education in Georgia. We're ranked really at the lowest category of public institutions within the region, going from Delaware to Texas for tuition for our students. And so one of the kind of the key factors there is also ensuring that we keep our pay for faculty competitive related to other institutions. And so we've been digging into the data there to ensure that we remain competitive in the market. But then also, ensuring that we build that faculty group of faculty within the state as well, which is ensuring that we have good pipelines from early undergrad, even in high school programs. Ensuring that we're drawing people in that are interested in healthcare, talking to our students, having advisors being proactive about talking to exceptional students about pursuing graduate degrees in their relative fields to ensure that we're continuing to grow the body of future professors that we'll have in the state.
Mm-hmm. I know there's been conversation the last few years, and I've had conversations in previous roles even about how we get particularly nurses ready to enter the workforce and ready to do patient care, bedside care on day one. And especially during COVID, I think there were some challenges between balancing clinical in-person versus components of the education curriculum that could be achieved in some sort of hybrid or remote capacity. Are you seeing newer advancements in workforce education that might help us maintain the fidelity and the readiness of those folks coming out, but also expedite students getting into the field?
Sure. I was actually just on campus at Dalton State College, which has a great nursing program, and so actually touring their facilities up there. What's true there is kind of true in many of the other institutions, but you have faculty that have served in those roles. The learning areas, there's actually skill areas where you have really it's kind of wild, like these very high tech mannequins that are very lifelike. They can replicate a lot of different particular symptoms. They're controlled from a back control room and that sort of thing. So we've been making investments in that type of technology, and then putting nurses and nursing students in a setting where they can get exposed to that early on, because it's one thing to train the nurses, right, and to have them ready to go into the field, but we also have to retain those nurses over time. So having some of these experiential learning opportunities earlier in the program ensure that there's clear expectations when they come out and take their first job. They know what to expect in a work environment, right? And there's no kind of unknowns there that can lead to hospitals having to worry about retention of that workforce.
I'm just a quick plug that I didn't prepare you for, and you don't have to respond, but just a quick plug for later, something to consider, I think, in your curriculums is something we talk about often, which is violence against our healthcare workforce, and just educating students coming out on what is appropriate, what is to be expected, especially with behavioral health patients, but also what is not, and how we train our folks to what to look out for and how to deal with that. So thank you for what you do in that regard. Okay, I'm going to shift gears a little bit, a little less policy, more about you and leadership, which I've had the privilege to see on a number of occasions, but not dissimilar to an association and what we deal with lots of different members in different geographic areas of the state, different kind of service delivery models and leaders. You've got 25 different public colleges and universities with their own presidents and their boards, with different student bodies and missions and priorities. How does the board in general, then you as chair, really corral that into a single set of shared priorities and vision to kind of lead the system towards ultimately goals for higher education for the state?
Sure. Well, I mean, it's really keeping our eye on what matters, which is enrollment rates, graduation rates, retention rates of students, ensuring that Georgians and even in our non-Georgian population, for those that want to go to college, they complete their degree, that we get them in, we match them up with the right institution. And so kind of from a universal standpoint, we really drive that home with our college presidents, because every one of our institutions is offering a different experience for their students, right? We have our access institutions that are serving, distinct population from our R1s. And so what's been really just kind of wonderful to see, having been on the board, is Georgians from all walks of life interacting with these institutions across the state. I mean, we have student bodies that are under 3,000. We have student bodies that are over 40,000. We have student bodies that average, the average age is in the mid 20s at some institutions. And we have other student bodies that are, very traditional, 18 to 22. But it's ensuring that all of those individuals that are coming and trusting their dollars, trusting their education to the system, have a clear path when they get there about how to walk through that degree process and ultimately achieve their goals. I mean, the statistic that we often cite is that if you have an undergraduate education, that's $1.4 million over the course of your lifetime on average as compared to someone who doesn't. And so we offer a very good value there with very valuable tuition compared to our peers across the system. And that goes back to having a great partnership with the General Assembly. We've been working with them on articulation agreements with TCSG to ensure that there's continuity for students that may start off in the technical college system and then want to transfer into a degree program at USG, that process is more seamless than it is now. And then we've been very fortunate with the support of the General Assembly coming alongside funding the funding formula that we use that offsets tuition cost. I think right now about 57% of total tuition cost is underwritten by the state, and that's an investment in not only these campuses, but more so in the economic development engine that are our students going out into the workforce.
Let's talk about your leadership skills a little bit and your teams. I mean, as an attorney, teams sometimes look different, but you have had a bunch of operational roles in your past as well. What do you look for in how you fill out a team? What makes good kind of up and coming attorneys or other folks that you really say that's somebody I want to put on my team?
Sure. Well, so, kind of talking about operational roles, when I was in the Secretary of State's office, I had a dual role as both chief of staff and legal counsel. And so, I was overseeing the work of attorneys and non-attorneys. And the same is true in the governor's office, whether that was oversight of particular state agencies that I had at different times, or also kind of stepping in and serving as interim director of Georgia EPD. I think one of the things that's really plaguing the workforce generally right now is the loss of interpersonal skills, right? And I put a high value on the ability for my employees, both attorneys and non-attorneys, to be able to be empathetic, to be present, to be responsive. And I think those maybe are some of the kind of soft skills that we're losing as people sit behind a computer screen more often and try to, work strictly on Zoom calls or Teams calls. So, particularly in a legal setting, particularly in private practice, I want to hire very responsive individuals, highly responsive individuals that even at an early age, I can put in front of clients and know that they are going to represent our firm and represent our values well, which is that we're going to, provide an exceptional work product that allows our clients to be successful. I've always kind of, and maybe this is being a lawyer for Brian Kemp for so long, but I've always had the view that attorneys are really kind of problem solvers and need to get their CEOs, need to get their companies to a strategic position of success. And I think it's very easy as a lawyer to sit and look at a problem and come up with all the reasons why something can't happen or hurdles that can be present for success. But we try to always frame our legal counsel in a way that moves the ball forward for our clients' businesses and interests. We had a situation here recently where a client could have sued a government agency and would have likely won. And that could have been a path, but they would have had to pay us for the litigation costs to go do that. So instead, we put together a more political legal strategy where we pursued some particular individuals within the agency. We pursued some particular legislators through our strategies team, and were able to accomplish the same goal without having to file a lawsuit at probably 10% of the cost that our client would have had to pay had we gone to court and litigated it, a year and a half with the state over that. And so those are the types of results that we like to provide. And having attorneys that think in that way, that think about how do we get to yes. I mean, that's a huge advantage for someone applying to get on my team.
Well, I think you answered one of my questions, which would have been, as hospital CEOs, how would we encourage folks to use their in-house counsels, which I think people oftentimes need to, I've had to grow in that regard as well of, I have in-house counsel, certainly at agencies had in-house. How do you really use them to be strategic as opposed to solving kind of whatever problem lands on your desk, but how to position? And so I think you probably hit the nail on the head on that. When you think about your own skills, well, go ahead. What were you going to say?
Yeah, I was just going to say, I do think that it's, one of the lessons that I've learned is that you do have to bring legal counsel in early. The earlier you're involved as a lawyer, likely, the easier it's going to be to solve any challenges that come up. So, I mean, there again, I was fortunate with the governor for so many years where if there was a meeting and there was, any minor issue, I was getting pulled into it just to have foreseeability, help see around corners from a legal perspective and provide, but you got to have the right lawyer for that. If your lawyer's a no person, if your lawyer's, not being pragmatic and not thinking strategically, then that's a shortcoming of that lawyer.
Yes, and here's how, not no because.
Right. Yeah, exactly.
That's right. When you think about your own skill set as a leader, like what do you know that you have to find on your team to balance you out on? Like maybe where you're not as strong and you know that you need to fill the gap with other people.
Sure. I mean, you kind of hit on this earlier. I'm, between Regents and family and legal practice and client, I mean, there's a lot of demands on my time. So one of the things that I have to have is very diligent other partners and associates that I'm working with that can kind of step in and help me time manage to make sure that our clients are getting timely feedback. But we have a great system for doing that. And, I also tend to be a very kind of big picture strategist. And so always having someone that can assist me in flagging, because I also want to know what all the risks are, right? So someone that's paying attention to the very small risk that can at least flag it and say, we need to think about a strategy around X, because if we get 3 months from now and this pops up as an issue, how are we going to handle it? And so I've got great partners that I'll work with that help complement me in that regard.
We have about 5 minutes left, but I have a couple questions before I get to my easy ones at the end. Chancellor made a big announcement in April that he's planning to retire.
How did I know this question was coming?
In your role as chair, really, how do you ensure, or how will you ensure kind of continuity and stability and kind of lead through that transition, whatever it looks like?
Yeah. So, what's interesting is there's been a lot of different styles of chancellors over the last 30 or 40 years in Georgia, a lot of different leadership styles, a lot of different backgrounds. What we need in a chancellor is a leader of leaders, right? So the chancellor represents the board's executive authority to oversee the system and works day in and day out with our college presidents, who are all highly successful, highly motivated leaders themselves. And so that's probably the skill set that I'm looking for the most is being a leader of leaders. So we established our search committee at our last board meeting, which is our exec and compensation committee, which is a standing committee of the board. It's comprised mostly of former chairs and vice chairs of the board, and they will actually lead the search. The profile will be developed by the entire board, and then we're utilizing some two great individuals who've given a lot of service to our state, Dr. Mark Becker, former president at Georgia State University, and Dr. Stephen Porch, who's a former chancellor during Governor Zell Miller's administration. And they're both consulting with the board to help us find the right candidates. But we're doing a national search, and we understand there's probably only a handful of people that meet that criteria. But we have a unique opportunity in Georgia that a lot of states don't. We have a unified system. I mean, you have Georgia and Georgia Tech under one umbrella, and you really don't see that in any other states where you have that type of cohesion and leadership responsibility across access institutions to flagships.
Well, we are hoping for all the success in that. We rely on the graduates and the individuals that y'all train every day. So you're doing great work, and we appreciate it and look forward to supporting you and the chancellor, whoever it may be in years to come. Okay. Couple of minutes left. Easy questions. What are you reading right now?
Oh man, that is a great question. I have mostly been reading kind of periodicals here lately. I'm usually reading a book.
What was the last one you read?
Oh my gosh, let me see. I'm got to think about that for a second.
All right, we'll come back.
All right.
I've stumped David.
Yeah. I mean, it's been a minute.
The latest political poll probably is what you read.
Yeah. It's campaign season.
I ask everybody about their daily non-negotiables. Like, I believe I know you well enough to know you are fairly routine. What's the top one or two things in your life that have to happen for David to be successful? People know that I'm either at the gym and I'm trying to have breakfast with my son every day.
It's get up early, spend some time in prayer and meditation, work out, and then go attack the day. Also, I've learned that you can work as long as you want to work, but having a stopping point for yourself ensures that you can be the same level of resiliency as you were before. And I do have an answer to your previous question. The last book I read was actually by a colleague on the board of Regents, T. Dallas Smith. It was his autobiography called In the Black. And it tells his story of coming up as a commercial real estate broker in Atlanta and really breaking barriers in what was largely a segregated industry when he's not largely a completely segregated industry when he got started. And I've known Dallas for a while. I've gotten to know Dallas even more, serving as his vice chair last year. But he's really a tremendous leader, and I would encourage anyone to check that out. It's funny. It's also really powerful to hear his story.
In the Black by T. Dallas.
Yeah.
And correct me if I'm wrong, but his construction company is one of the largest now across the country.
I believe it's the largest commercial real estate, minority-owned commercial real estate firm in the country. Yeah, that's right. All
right. Parting thoughts. We do have one little comment. Shout out to the UGA alum. So you're getting something there from UGA.
Go Dogs.
Go Dogs. That's right. David, thank you for obviously your service to the state, to your continued service in the board and what you do in the private sector. I'm sure some of our hospitals rely on y'all's services from time to time. Thank you for joining me today. We appreciate you and look forward to working with you on healthcare workforce and all the things as we go forward.
Well, thank you for having me. It's great to be with everyone. I hope everybody has a great rest of the day, and thank you again.
Thanks, David.